Psychiatric medications. These are the 8 myths I've come up with. This is, 35 plus years of doing this. What's myth number 1 of taking psychiatric medication? It masks the problem. No, most of these are biological. Most of them are genetic. They run in families. They're not going to mask anything. If someone's depressed, it helps you lessen the depression. If you have ADD, it treats the ADD. It doesn't mask anything. It will help you deal with any issues you may have that precipitated the problem. That's possible. But when someone's depressed, anxious, panic disorder, obsessive compulsive disorder, bipolar, schizophrenia, medicines don't mask anything. They treat it. If you're diabetic, you take insulin. Does that mask your illness? Well, it takes away the symptoms of the illness, but it doesn't mask anything. That's not reality. Number 2, if I take it one time, I'll need it the rest of my life. No, that's not true. Most of the time, people take these medicines for about a year. It doesn't cause the illness to make you need this medicine for the rest of your life. No, most people, I say, how long am I going to take it? As long as the illness continues and as long as it's working. No one takes it for life. That's ridiculous. That never happens, ever. I've never seen it. If I take this medicine, it'll damage my brain. There's no evidence of that. There's no evidence that psychiatric medicines affect your brain. There are exceptions here. Benzodiazepines may alter that certain GABA receptor to make it a little bit more, desensitize it over time. It's possible. Rare. Someone says, I'm on psychiatric medicines, I can never have a drink. With the exception of benzodiazepines, there are no interaction with psychiatric medicines and alcohol. They just may not work, but there's no true psychiatric interaction. With the exception of benzodiazepines like Ativan, Klonopin, Xanax, you really shouldn't drink on them. It's synergistic. There's no lethal interaction, but the respiratory depression and the gag reflex become numbed at higher doses. So if you mix the two at high doses, yeah, you kill yourself. It's extremely dangerous. Don't do it. But that would be the one exception where you could drink, but you drink too much, you could kill yourself. Another myth, I'll get better right away. Most of them take probably 4 to 6 weeks to kick in. Nothing happens right away. With the exception of benzodiazepines like Xanax, Klonopin, Ativan, lorazepam, which work within 45 minutes. Here's another one I get. Well, it worked for my friend. It will work for me. It doesn't work that way. Everyone's different. Here's another one I get. Well, I want to do it the natural route and the over-the-counter route because it's safer. No, those over-the-counter drugs are just as dangerous. So are the natural route. As a matter of fact, the over-the-counter drugs result in more successful overdoses and deaths than do the prescription drugs. So that's not reality. Those are just a little myths I wanted to go through. You can get more at my blog, Agresti.com. And hopefully you like the videos, subscribe, like, appreciate comments. And a shout out to the people in United Arab Emirates. Thanks for the support.